Infectious disease specialists are looking overseas to Italy as what could possibly happen with the coronavirus here at home.
3 weeks ago, there were a handful of cases in Italy. There's now more than 10,000. Investigative reporter Angie Ricono has some inside perspective from northern Italy.
My relatives live up north, right next to the Lombardia region, which is a red zone section. One cousin is a doctor on the front lines battling the coronavirus.
We do a triage on phone, and if someone is suspected, we call ambulance emergency.
Suspected corona patients are picked up by ambulance. Staff is in protective gear. Dr. Lara Ricono asked these questions from a checklist. Have they traveled to Lombardia, which is a nearby hotspot? Have they been on an airplane or in a nightclub? And then they ask specific information about upper respiratory problems and other symptoms. There's a clear division of healthcare workers, those who are exposed daily to coronavirus, and then other doctors who work phones and treat patients directly in their homes.
We live day by day because no one knows exactly what to do.
Laura is worried about patients she cares for in nursing homes and her mom.
I'm worried, yes, sure, because my mother is old and she's not very well. So yes, I'm worried.
Italy's healthcare system is overwhelmed. The country is trying to pull doctors out of retirement to treat this pandemic. Here's what Lara reports. Only emergency surgeries are being performed. They've even had to scrap cardio and neuro cases. Supplies are critically low. This includes gowns and masks. Hospitals have run out of intensive care beds. It's something she emphasized constantly during our interview. Other countries need to think about what happens if a wave of coronavirus spreads. Where will you treat all the critically sick patients?
Things are changing every hour.
A few miles away is my cousin Roberta. She's a working mom trying to figure out the school plan for her teenage sons,
School is still closed.
who pretty much consider this an extended holiday.
Last week was already closed. This week closed as well. Next week as well. So this is the third week that they have to stay home.
Many schools and universities are shifting gears and putting classes online.
For many people, it's like a flu. We have lots of people that do not have symptoms. They have the virus, but they're not sick. I'm worried for the economy more than for the health at the moment.
Things have shut down all over Italy. There's no masses, weddings, or funerals. Restaurants must close early. Prisons are now on lockdown, so are nursing homes. Canals and top tourist attractions are empty.
We have to follow what the government says, to follow the rules. If they say that we don't have to go to the restaurant or to the supermarket or to the mall, we have to follow what they say.
Not everyone is following the rules. It's clear many people in the red zones fled south when the quarantine was announced. But now all of Italy is under a new policy called I Stay Home. The hope is eliminating all public gatherings will slow the spread of the coronavirus.
I hope so. Finger crossed.
How the restrictive policies work will be important information for other countries like the U.S. The one known presumptive case in Missouri is a woman who recently studied in Milan, Italy. Angie Ricono, KCTV5 News.